One moment you're lifting your arm, the next, it's shooting pain and weakness. What just happened? Chances are it's a rotator cuff tear, one of the most common shoulder injuries. Let's break down what a rotator cuff tear is and how surgery can help you heal. The rotator cuff is a group of 4 muscles and tendons that keep your shoulder stable and strong. It's what lets you throw, lift, wave, or reach into the top cabinet without thinking. Tears can happen from a fall, repetitive overhead motion, or just wear and tear over time. The tendon can partially fray or completely detach from the bone, leading to pain, weakness, and limited mobility. Diagnosis often involves an MRI or ultrasound to confirm the size and location of the tear. Not all tears need surgery, but for active patients or large painful tears, surgical repair is often the best option. The most common approach is arthroscopic surgery, a minimally invasive procedure using tiny instruments and a camera. Surgeons clean the torn edges, drill small holes in the bone, and reattach the tendon using anchors and sutures. These anchors hold the tendon firmly while it heals back to the bone. Over the next few months, the tendon reintegrates. Physical therapy helps retrain movement. It's a slow process, but most patients regain strength, range of motion, and function. The rotator cuff may be small, but its role is massive. And with modern techniques, even full tears can be repaired with precision and care. If this helped clarify things, give us a like and subscribe for more quick medical explainers.